I'm Adela Redzic. I'm currently the Assistant Vice President of Dental Operations at AltaMed Health Services. We are a federally qualified health center, and we have clinics across Los Angeles and Orange County that provide a range of services from medical, behavioral health, dental, women's health, sports medicine, and so on. But our primary focus is to work with the underserved community. So we are a safety net provider, and we provide services to patients that may not have other alternatives. And not only are we here to provide access to them, but we also want to do it at the highest quality care and in a safe environment. That is true, and it's really an amazing history that AltaMed has. We've been in the communities for over 50 years, and we continue to expand because there continues to be a need for these specific populations. I joined the organization 10 years ago, a little bit over now, and for my division, which is the dental services, at that time, we had 4 dental sites, and we currently have 14, going on 16. So it's a really tremendous growth to see over the amount of time, but primarily to see that as much effort as we put out there to reach everyone, there continues to be a need for us to increase access for all different kinds of services, especially in the lower income areas. I didn't see myself as being in healthcare. I think I somewhat stumbled upon it. My mom is a nurse. I think when I was younger, she really wanted me to work in the hospital in some capacity. And I said, I can't see blood. I can't see it every day, so I need to see if I can do something different. And I went to school for business. When I finished my undergraduate degree, I was somewhat recruited by a dental organization. And at that time, really was just looking to see what is out there, and accepted it. That's how I got my foot in the door. There was a really big sales aspect to it at that time, working in for-profit and in the dental industry, that I didn't necessarily feel like suited me or my personality. So I left operations for a little while until I got a call from someone I had worked with that said, there's this organization, I think you're really going to like their mission, just check it out. And it was actually my first time hearing about what federally qualified health centers do. And the moment I stepped in the door, I was amazed by the mission and by what the organization stands for, and really, never looked back since then. Being able to, use my skills and think about the end result being helping people who may not have other resources, it's really what's kept me coming back, and being surrounded by other people who are there to do the same thing. I think networking is really key. It's building relationships to some degree, to really get to learn from others, to have mentors, to have advice, to have connections. And I think now, after the pandemic, it may have become a little more difficult, and I'll tell you why. I think we got more used to more of a virtual network, and especially for students who may not have had as many interactions in person now, it may be more challenging to think about how do you reach out and how do you go to these events and where do you start. But I'll let you know that I think there's a lot of different resources, and sometimes we have to step outside of our comfort zone to really be able to make those connections. So whether it's going to a networking event where you put yourself out there and you're getting to know other people, but it may actually even start virtually. Like I mentioned, I'm an introvert, so sometimes it's not as easy or in my comfort zone to go out to a large event, but you can make a professional connection through different networks, maybe LinkedIn or different organizations online. Start looking at somebody's accomplishments, seeing how they relate to yours, ask them for advice, what would you like to learn from them, and then build up to the, let's meet in person, let's see how we can connect on a professional level and build relationships from there. Yeah, I think having mentors is really key. And as somebody, if you're the mentee, I think the best way you can take advantage of a mentor is really thinking about what do you admire about this person, what type of questions can you ask, and be prepared with that. I've had a few mentors in my life, and it has always been someone whose personality or whose skill set is very different from mine. And sometimes that's not what we naturally seek out, but for me it was incredibly beneficial because they got me to see things in a different way. So if I needed advice, professional advice, thinking about what job I would want to take, or what industry to look at, or even if I'm having a challenge at work, our skill set really come from our experiences and from our education, and experiences are different from everyone. So there'll never be a time where I'm going to have all of the answers, but somebody else may have been in a situation that I consider to be a barrier, and they can help guide me. And that's really what I think is the biggest purpose of having mentors, and the biggest benefit is just to get insight of how do you work through a problem. Not necessarily to have all the answers, but to have different point of views, to have different options to consider, to have a sounding board, to get advice, to ask questions, and to get somebody to ask you questions, to think outside of the box and maybe think of things you may not have seen before. Yes, I think communication skills and the ability to interact with others at all levels, different types of personalities, especially in the health services industry. We work with people. We have to be able to build relationships in every way. And as I mentioned, that may not be as easy for everyone, but it just takes practice, and I think that's what we can get. But the basic communication skills, I think presentation skills, being able to communicate effectively in a concise manner, in verbally and in writing, will be really key. Negotiation skills and almost like influencing, being able to look at and have difficult discussions and conversations and work through disagreements with others, or in being able to understand and address opposing points of view. Yeah, I think it's different state by state, and you're correct. In California, I think there are more limitations on what hygienists can do than other states that I've talked to and other organizations across the nation, where hygienists seem to have a bit more abilities to work without the direct supervision. In my organization, we've actually really been able to leverage the relationships between hygienists and dentists, especially as a result of the pandemic, and I'll explain why. There was, for a time, dental clinics had to shut down during the pandemic. It was a really difficult time for the industry overall. But as part of it, there were some more innovative ways that we were able to think about providing care in the future. And part of it is through teledentistry. And what that means is us being able to go where the patient is and meet them where they are. So we're able to leverage hygienists to go, for example, to schools and to see the patient and provide services, and for a dentist to remotely be able to look at the treatment plans and the x-rays and actually validate the treatment, have something established for the patient. So it's really allowing us to maximize access versus having only dentists that are able to do the work. So we're looking at how do we complement the two so that they can work best together. I think there's a few different things that I would address and that I see. One is when we think about how do we incentivize providers for what they do and what do our payment systems look like, right? Which is where prevention is usually not on the highest scale, and a lot of service providers may not see it as sustainable. The other way to look at this is what are we really trying to do in the best interest of the patient? And one of the things that the industry is talking about everywhere, not just at AltaMed, is moving towards value-based care. And that is thinking about incentivizing providers, service providers, for really doing what's in the best interest of the patient, because it's looking at the outcomes. I think it will take us quite a bit to get there. I think there's some undoing of our current system that we'll have to work on to get us on the right path. But that the key will really be integrated care from where I see it. I think in our system currently, we work in a lot of silos, whether it's primary care, specialty care, behavioral health, dentistry, but all of these components are crucial to a patient's overall health, right? We can't just address one thing, which might be their primary medical doctor, but they get an infection in their gums that then travels through their blood, right, through the rest of their body if they don't address their dental needs. So that's where I think is going to be key, is getting the buy-in and the collaboration from multiple specialties that, including behavioral health, which is something that is so important that we see emerge now as a result of the pandemic more than ever. And how do we get to collaborate? How do we get to integrate for the patient's best benefit? And but the good news is, I think our technology is already getting there, right? I think we have systems that allow us to share the patient's record and have information of them. Now it's just a matter of getting buy-in and getting that integration to be seamless so that we can look at the overall health of the patient and address any gaps in care that they may be.